Go.
Hello, my name is Stephanie. We're here at Healthcare-Edu. It's one of the lab days. I have students here, and one student was so gracious enough. We are going to demonstrate nail care as listed on the Prometrics checklist. Now, the assumption is that I've already washed my hands. You do that prior to every skill. If you need to watch that, go back and watch my hand washing video. I've gathered my supplies, and I'll go over what they are. They're the paper towels, and we'll lay them out. Lotion, 2 washcloths, hand towels, a nail file, orange stick, and soap, okay? So for the ease of teaching, we're here at the desk, but this might be in the patient's bed. So I'm going to knock. My name is Stephanie. I'm here to do your nail care. I'm your CNA today. Can I take a look at 2 patient identifiers? Perfect. And I won't touch the patient. I always differentiate between that. Okay, and if the patient was in bed, I would raise the bed for proper body mechanics and swing the bedside table over. But this skill, I just want to show you the steps and kind of things that you would say. So I'm using the paper towel to lay down my clean surface. All right, I have my lotion. I have my hand towel. The hand towel, I will open it up like so and lay it on my clean surface. And that's to dry my client's hands. I have my 2 washcloths, okay? I have my orange stick. We're going to use the flat surface and not the pointy surface. I have my soap, and I have my nail file, okay? Now, it's simulation depending on the testing center. You could either say you came in with water or go back out to get the water, all right? So I'll say I came in with the water. If you go back out to get actual water, if they want you to use, you have to make sure that the patient's bed wasn't elevated, okay? So anytime you're doing anything with water, you're gonna check the water temperature to say it's within appropriate range, and you also have the patient check with their elbow. Can you check the water temperature, please? Okay, perfect. All right, and so this video is just going over the skills, but I would have my gloves on for nail care. I'm going to sit, and it's gonna do one hand. Do you mind soaking your hand in there? Okay, perfect. And so now I'm going to make my mitt. You could watch my partial bed bath video to see how to make a mitt. Okay, I make my mitt. I have soap, because remember, we never want the water to be too soapy. You always protect the patient's joint. Okay, so I'm holding the patient at the wrist, and I'm going to just clean her hands. Wash with the soap. Lay my towel down, all right? And I have my rinse towel. And you might say, how come? Because you're soaking in the water, but still get a rinse towel and to do it just like you would do with the bed bath, okay? I'm going to wet my washcloth and rinse, okay? So I did soap, I did rinse. Now what I can do as well here while the patient's hand is soaking, I could do range of motion exercises. So I could have her, can you just make a fist? Okay, open your hands like so, and you could do that 3 times there. All right, are you in any pain or discomfort? No. All right, you can relax. So that's 2 skills in one, but it's just something you could do while you're doing hand care. So I'm going to take her hand out, actually lay it right onto the towel. I'm going to pat dry her hands, add some lotion. All right, give a nice little rub down, add lotion. And now I want to do nail care. So I could file the nails one at a time, file the nails, and then with the orange stick, I'm going to use this flat side to kind of clean the nail bed. With the flat side, I don't really use that pointy side of the nail care. So how does that feel?
Good.
You're all set? Okay, perfect. So my items would go right into the hamper, okay? My 2 washcloths and hand towels, and I would take my gloves off, and what I teach my students, once you take your gloves off, I would put her in all of the safety positions, which is the bed low and locked, side rails up, call light within reach, and the patient comfortable. So once I take care of the patient, I then take care of my bedside table by gathering all of my supplies. I would throw my paper towels in the trash can. I would exit the room with all of the supplies, go to the bathroom, empty it, put my basin away, hand hygiene, and then I would be done.